Hello, everyone, and welcome to SoftFil Academy's webinar. We are very happy to welcome all of you tonight. We are live from Dr. Sandrine Sebban's office in Paris. So I wanted to just give you a few updates, waiting for everyone to connect. This webinar is being recorded and it will be available from tomorrow on SoftFil Academy's website. It will also be available on SoftFil Academy's YouTube platform, and it will be subtitled in French, German, Spanish, and Spanish. So there is no problem if you're missing a part of the webinar. You will have access to it freely from tomorrow. I'm just trying to pass the slides. All right. So I would like to welcome Dr. Sandrine Sebban and to thank her for organizing this webinar with us. Welcome, Dr. Sebban. I will start with introducing someone that needs no introduction anymore, of course, but just giving a little bit of background. Dr. Sebban is an international trainer and KOL specialized in the broad spectrum of aesthetics. She's an aesthetic doctor from Paris in France, and she is the inventor of several injection methods and various disrupted and patented products. So I will cite a few of those techniques. She's the inventor of the soft filling technique, the one-point technique, and the stop facial aging methods that are famous cannula injection technique. She also is the creator of the patented pilot needle, the SoftFil EasyGuide, that you will see a bit more in this webinar. And her latest invention is the Topilase from SoftFil that was released in 2021 and that was awarded several times last year. It's hyaluronidase-based topical care. So tonight the topic is which cannula to use for which zone. So Dr. Sebban will introduce all of our cannulas and explain to everyone where is it best to use them. So Dr. Sebban, I will leave you now the floor.
Thank you, Anna. Thank you very much. And greetings from Paris, of course. And we are so happy to have you here in Paris, in my office today. Of course, the focus will be on cannulas and which cannulas for which zone. I think it's a very important topic because it is the heart of our practice. As you know, every day when we are injecting, we're thinking which cannula can I use with this product and in which zone. So I think that now to have a complete explanation could be really interesting. We have a patient, very interesting patient. She is a 51-year-old. She was never injected in the face and only on the lips by me 2 months ago. And today I will show you on the patient at first all the indications that we can have in many patients and many indications with cannulas. And after, I will inject the patient. So I have 15 minutes to show you everything. I will try to be very synthetic. So at first, just to show you the range of cannulas of SoftFil is very, you can see here, very large. SoftFil cannulas are created for, of course, face and body. But today you have here the cannulas dedicated for face injection. And I can, of course, I will show you all indications with this kind of cannulas, but I would like to show you at first why we have different lengths and why we have different colors of Enbasis. You have to know, and you know, of course, that the colors of Enbasis is exactly the same in all countries, meaning if you use the orange one in I don't know, in the east of the world, it's exactly the same caliber than if you use it in the north of the world. So this is universal code of gauge mean caliber of the cannula. So the larger of the cannula. And for example, we have the thinner cannula of SoftFil is the 30 gauge cannula, the 30 like needle, as you can see. I don't know if you can see very well on, but I can come to you just to show you the cannula, okay? This is a 31. The 31 was really very important at the beginning of the launching of cannulas injection when I did it in 2008 at the beginning. It was very useful because at the beginning we thought it was very safe. But now the problem is that with, and thanks to all the publications, scientific publications, we know now that it could be a little bit dangerous because it's like needle. It's not exactly like needle, but it could be if you have a very strong gesture when you are injecting. The tip of the cannula is thin, so you can through a vessels and it can be a problem. So be careful with the 30. You can use it, of course, with the very fine HA. With very fine lines, you can use it, but be careful and be very, superficial and in knowledge of anatomy, of course, in this case. You have 3 sizes of 27 gauge. The 27 gauge cannula is has a gray embassis, and you have here 5 centimeter length cannula. You see here 27 gauge 5 centimeter length, and for example you have here the 27 gauge 4 centimeter length. This is the most used cannula from the 27 in the world, but you can have the 25 millimeter, very useful for lips, for example, for the small lips. You can be very precise as a needle. So you have to know that usually all the 27 are used for lips. Lips injection, you know, the border of the lips, the vermilion border, the vermilion, and also of course the perioral region of the lips. It's very useful for this, but you have to be careful because, as you know, anatomy could be dangerous in this region, and you have to consider the cannula as a needle. Of course, it's safer, but it's not safer as another cannula, like you see this very larger cannula. So be careful with that. When you use a 27, I will not inject the lips today. I will inject a lot of areas, but not lips. So we will have another webinar for that. But the lips could be very interesting with the 27. It's my favorite cannula for this, but I use a lot of 25. 25 is the orange and the very, you know, the edgery of the range. The 25 gauge, it is the 25-30 here, so 3 centimeter, 25-40, 4 centimeter, and you have the 25-50 here, or the last one, the 25-60. So I use a lot of 25. I'm not, you know, alone to use this cannula, because this is the most important cannula I use in the world. The 25-50 is the most important. Why? Because she has the best balance between rigidity and flexibility. So you can go in many tissue. You can across the fat. You can across, you know, all the anatomical structure. and going on the bone. It is enough rigid to go on the bone with. So we will see, of course, an injection today with the 25, of course, in the nasolabial fold and in the perioral region. I will use a lot of 23 today. The 23 is really adapted to deep anatomical level. So usually we use a 23 for the deep fat and for the bone, the periosteum. You can use it on the superficial fat, of course. It's very interesting for that. You have now to understand why and how is manufacture cannula. For a SoftFil company, it's very important to understand that you have to take in consideration the red dot on the embasis. This is the most important landmark that you have to consider when you use a cannula, because the red dot show you where the product goes out. Of course, the cannula is different of the needle because the cannula is round at the tip. And if I do that, no problem, I don't have pain. If I do that with a needle, it will be impossible. So it's very hard to cross an anatomical structure with the cannula. But you have to know that the most important difference with the needle is that the orifice at the tip is lateral. And as it's lateral, if you want to be precise when you are injecting, you have to consider the red dot on the embasis. The SoftFil cannulas have a Luer lock embasis, so very easy to adapt to the syringe. But there is a tool very important, you know, this is the forceps, very important, you know, to pinch the cannula to the syringe. This is mainly important if you use a viscous product in order to conserve your product, of course, and don't have expulsion of product when you are injecting. The 23 cannula is with 7 centimeter length. I will use it on my patient on the jawline, but you have the 5 centimeter length with the temples, very interesting, and I will use it for my patient. We can use it on zygomatic area or other very short areas like, you know, vertical branch of the mandibular. It's very interesting too. But this is a cannula specifically dedicated to the deep level. And after that, you have the 23 cannula with 3 centimeters. This is my favorite cannula for shin injection, and I will use it on my patient today. Just a reminder, you have the 22, all the family 22. You have the 2240, 2250, 2270, and 2290. And of course, you have the 20, very interesting for thick skin and deep level. This is interesting, of course, to inject viscous product with high G prime. And you have the 18 gauge is useful for fat. You have the 16 and 14. This is the large cannulas. You can see here, they are quite not flexible, but very good material for fat and for, you know, you can use it for fillers if you prefer, but it could be a little bit hard, you know, to have a good adaptation to the tissue. What is very interesting when you use a flexible cannula, for example, the 23, you see that you can move the cannula like that. And when you want to go to a convex zone or concave zone, you can, you know, adapt your movement in the same plan. And if you want to go straight, you can, because this is a good adequation, you know, with the caliber. But if you want to go straight with a large cannula like 23, it's better to use a short cannula. So now let's go to the patient. Let's go to our patient. We will, of course, put the patient in a sitting position. Vous pouvez vous adapter et arranger votre dos au fur et à mesure.